of mine.
The mama's speaking.
Sorry, just,
No.
yeah, I know, right? Yeah.
No one's gonna help me.
I mean,
That's all I ask.
Okay, so the baroreceptors, they detect the change of blood pressure. They will send out regulation impulses, if you will, in order for either the heart rate to increase and or the muscle contractility of the heart to increase stroke volume. Because again, for perfusion to occur, we have to have the proper heart rate and the stroke volume. We gotta have enough volume going throughout the system in order for it to maintain blood pressure, because if it didn't, then as you change from position from sitting to standing, you would pass out. Alright, so again, it just kind of depends on what needs to increase as far as the baroreceptors are concerned. And then it goes into this nice little following equation. Increase in blood pressure, you increase the baroreception stretch, which increases the impulses, which increases this. Okay, don't worry so much about that. Okay, just understand that there's baroreceptors within your aortic arch and the chronosinuses that keep you on track with blood pressure to maintain the change in position of a patient, your activities, and so forth. There's not a whole lot on National Registry when it comes to your nice black and white equation that you see here. Just like on the next page, this right here, not so much. Just understand where the baroreceptors are and what they're responsible for. It's going to either increase the tone of the sympathetic, which is going to release epi and norepi, and then it'll increase the heart rate and also increase the strength of the contraction of the heart muscle itself. And then the opposite end of that would actually bring everything back down with an increase in sympathetic tone, parasympathetic tone. And then your chemoreceptor reflexes, okay, again, these chemoreceptors monitor pH, carbon dioxide levels, oxygen levels within the system. And it will initiate the brainstem in order to increase ventilation or increase the depth or the tidal volume, if you will, in order to bring everything back to homeostasis. So again, there's a long list, okay, to maintain aerobic metabolism. All of these things have to be in place. This is how come it's very important to understand artificial ventilation, oxygenation to our patient. Because if we were to start, again, at the patency of the airway, remember that the airway is just not just the nose and mouth. It starts here and ends in the alveoli, and any type of disturbance there we need to try to correct. Just like perfusion, if someone's bleeding out, then we need to stop in order to maintain the proper pressure of perfusion for the body to pick up the oxygen for diffusion to happen and then continue throughout the body. And then we got to have perfusion, ventilation match, and the ratio be equal. If not, then we need to accommodate what we can. Is that positive pressure ventilation, which is going to increase not only the tidal volume, but also the oxygenation, because if we're giving positive pressure ventilation to someone, we've got them on 100% oxygen at that point. But we don't want to take that to the extreme where we're hyper-oxygenating them and hyperventilating them, because that can actually cause a reverse effect than what we're looking for. And then we hope and pray to God that the body's doing its normal thing by initiating what it needs to from the cellular level for things to occur to maintain pressure and things like that we have no control over, other than shoot them in the butt with some epi and then kickstart some things, okay? But again, the body's got to do its thing. Cardiac output's important. We've got to have enough preload. So again, as the chambers are filling up, does it have enough fluid to eject out? Now, when we talked about left-sided heart failure, I have this in as small as it is. So we talked about congestive heart failure, and we talked about the fact, okay, so here's a normal heart, and when you open it up, right, everything's proportioned, okay? The even though this is slightly thicker, which it should be, which is the left ventricle, it's got to be a little bit thicker because of the fact that it is pumping blood throughout the rest of the body through the aorta. You're talking thousands of miles worth of vessels, okay? 5 liters, your entire blood supply in a minute. Okay, so yeah, I'm expecting the left ventricle to be a little bit thicker. However, if you have an increase in diastolic pressure, because again, for whatever reason, the guy suffered a heart attack or something of the sort, then what happens is you go into congestive heart failure, in which now the left ventricle is huge, and you notice that the decrease in volume in that chamber is now decreased significantly because of the pressure that left ventricle has got to, see the difference? The pressure that's left there that it's going to have to push through the aorta is now significant, which again is going to overtax this part of the heart muscle, and then over time, just like when you build muscles, this is what happens, but at the same time, you're decreasing the volume now that the left ventricle is able to distribute. Major issue here, major. So that's like my PSA announcement. Make sure you go to the doctor every year and get checked, okay? Let them check your blood pressure and things like that, and tell them to check your blood pressure manually, not with the automated blood pressure machine. Because that is what the doctor is basing his diagnosis on. Oh, you got pre-hypertension. And I've noticed this over the past several times. Okay, well, if you're doing it with an automated blood pressure machine, okay, so test the theory. If you don't believe me, the next time you go to the doctor's office and you get a blood pressure that you don't think's right, have them pull out a manual blood pressure cuff and see what happens. Deer in headlight look. Okay, because they don't, believe it or not, some of the doctors' offices now don't have them.
I was about to say, they probably don't even have them.
I know for a fact they don't have them at Martin Army because I've brought them on a couple of times going, hey, I really want my blood pressure checked manually.
What's that?
Exactly. It's like, I need to go try to find one. Yeah, you might want to. You know, because the very first thing that the doctor says is like, oh wow, I see that you're pre-hypertensive. And I'm looking at her like, I don't think so. Nice try. This is what the doctor is basing their diagnosis of you on. If you know for a fact what your blood pressure runs, question it. Be your own patient advocate, not just for the patients we carry, but yourself. Your family members, because you know, I go to the doctor with my husband all the time. Yeah, well, he needs to be on high blood pressure medicine. No, he don't. Because I know what his blood pressure runs because I've checked it multiple times. You know what I'm saying? You know, so yeah, try again. You're not going to put him on a medication that he not necessarily needs right now. You know what I'm saying? We don't want to do that. All right. So a lot of information on pathophysiology. Again, don't be so focused as far as the actual mechanics, if you will, behind the baroreceptors, chemoreceptors. Just understand one, where they're located, and what's their function. Do they stimulate? Understand when they stimulate a certain autonomic nervous system, whether that be sympathetic or parasympathetic, based on what's going on with the body. So if there's a decrease in blood pressure, then you know that those baroreceptors are going to kick in and stimulate the sympathetic in order to bring blood pressure back up, and vice versa on the parasympathetic when blood pressure is like way too high, we need to bring it down. So understand that concept is more important than trying to give me a pattern of, okay, well, what happens, and tell me from that point to this point that it's not the purpose. Understand what happens in the process, okay? That's it in a nutshell. That's what I need for you to understand, not necessarily the true mechanics. Just understand they're responsible to monitor blood pressure and regulate blood pressure, and they do that by either stimulating the sympathetic or the parasympathetic on a dime's notice. I mean, you have to understand the body responds every moment. It's not, okay, oh my gosh, something's wrong. Here, let me get you. And then I touch him and then he actually responds. It's an automatic thing. I recognize there's a drop, hey Earl, boom, right now, type of thing. This is how quick our body systems are, okay? And again, understand the complexity And the categories from the bottom, the functional unit, the cell, all the way up to the body, you'll understand why we need to save and salvage all the little functional units. Understand the hierarchy. Because if we can save the little ones, the next hierarchy is tissues, which is a group of cells doing a common function to do one thing, and that's a tissue. A group of tissues doing the same thing, or a common purpose is an organ. An organ, okay, and it goes up to finally the organism. So if we can help them down here, then this is going to affect the hierarchy, if you will. Because if we don't, and cells begun to die, then you have a group of cells that die, which is going to affect tissues. Tissues will then begin to die, which will affect organs, which will affect multiple systems, and then you eventually will have organism death. That's pretty much wrapped up in a nutshell. Understand the hierarchy and the importance of why we're trying to save the little ones. Okay? Now, Joseph kind of hit today. Okay, the first 5 never change except for CPR and trauma, certain trauma cases. Okay, so he hit one in which if you come up on someone who's got an arterial bleed, so please understand, we're going to go into a lot more detail next semester when we hit trauma, is the fact with an arterial bleed, every time your heart beats, you're squirting blood. Depending on the size of that artery, you can bleed out in a couple of minutes, or you can bleed out in maybe 30, okay? So in that particular situation, we immediately want to try to stop it, and if we can't within a few seconds, then a tourniquet goes on an extremity immediately. There is no, let's see if this works, okay? We put direct pressure, we elevate, whatever. If we can't get that blood to stop, you need to stop it, which means putting on a tourniquet, okay? Research has a lot to do with what we do in the field, in the civilian world, because we learned a lot from the military world, especially in war times. So, again, one of the things that we took out from Combat Lifesaver Trainer was we didn't want y'all starting IVs anymore. You know why? Because your patient would be bleeding out, and you are so focused on starting that IV. That IV is not going to save your dude. Stopping the bleeding is going to save your dude. Okay, so that's part of the reason why over the practice of research, they stopped teaching the Combat Lifesaver Trainers to start IVs in the field.
I got a good question about that. Something that was kind of dangerous back in 2010, and they were considering using out in the field. I think it was called hex starch. It was something to expand the volume of the fluid. So rather than just regular saline going in, this fluid would actually help expand and put pressure on the system.
Which was detrimental to people. And that's just because it was depleting the oxygen capability of the cells that were roaming around.
Dangerous than most of us didn't even realize. We've been bugs.
Yep, and that's why, because again, whenever I first started in the EMS in the late 80s, early 90s, was when we had a trauma patient and they were fluid depleted, we would dump a whole lot of fluid in them, especially lactated ringers. I was just taught different where we didn't do that, where, okay, initially we did, but then we noticed, okay, well, we're having a high rate of mortality when we do that. So we kind of cut back on that. We would start 2 large bore IVs, and we had one at a slow KVO rate, and the other one kind of wide open with a fluid challenge, and then we back it off. And again, we don't want to take the circulating cells within the system and water them down, because then they're few and far between getting to their target locations, and then that causes secondary and tertiary effects. So things we learned with research. That is the driving force behind any medical field that you're in, because you have to understand the medical field is a practice, and it's a practice for a reason. And it is ever so dynamic. It's ever changing. So what I'm teaching you now is probably going to change in about 6 months. Okay, that's just because of what's coming out there. Some of the services now are carrying handheld ultrasounds. Okay, great. That's great to a degree, because it just gives us confirmation, yeah, he's bleeding in the head, or yeah, he's bleeding in the abdomen, but okay, that's a great diagnostic tool, but other things can tell me that they're bleeding internally. You know what I'm saying? But they're actually putting those out there, especially for the rural areas because of the fact that when they are transporting via helicopter or whatever, they need to notify the level 1 trauma centers, hey, we got a abdominal bleed, whatever, be on standby, because at that point they're just gonna have to, I've seen chests being cracked open at Grady in the ER. They started surgeries in the ER, and all the doctors kind of get on the stretcher and would roll them to the OR. So I mean, a lot of things change, but again, it's based on research. That's another one. Starting IVs for combat lifesavers, they took that out like within like the first year. After they taught it, they were like, oops. And
You got was teaching them like OPA, NPA, things like that.
yeah, and needle
Yeah.
decompression, because that is a life threat if it's not corrected immediately.
Yeah.
So again, a lot of medicine is a practice. You know, sometimes we have to do like a trial and error, if you will. That's just like the new vaccine that's coming out for COVID. You know, I'm very hesitant about the vaccine. Not sure if I want to get it.
Yeah.
That's just like the flu. That's just like the flu shot. You know, because again, by the time I get a flu shot, the flu shot is for the last year's strand, and they think they got maybe an interpretation of the new strand. They got bull crap. I'll take my chances. I'll get sick. Okay, I'm taking my chances. I'm not going to get a flu shot that, okay, they're injecting me with something that my body, one, has never been exposed to, and now you're exposing it to me. And I tell you what, there's like 2 years in a row that I got the flu shot that was mandatory at Grady whenever I was working there. By the 3rd year, I refused it. I declined it straight up. My doctor was like, I said, I asked my doctor to write a note. I'm not taking it because I got sick for 3 weeks every time I got the flu shot. No, I'll take my chances because again, you being exposed out there in the field, it kind of builds your immune system, if you will. I'm just here to tell you, we saw a lot of crap at Grady. Okay, I think I was out for those 3 weeks on those 2 years, and I don't think I was ever sick for anything else. Okay, but again, proper PPEs, proper hand washing, and hand sanitizer and everything. I mean, we used to carry a hand sanitizer like it was, toilet paper in our back pocket. After we finished, gloves came off, we were hand sanitizing, and we properly disinfected our truck every day after, during the day after every call, and then again at the end of the shift. So again, this is part of the reason why last week, whenever we were talking about scene safety and stuff like that, and you're getting all your equipment, especially personal protective equipment, I'm not kidding you. By the time you have gloves on and you're driving to the scene, think about how many germs you're touching and what you're touching that you're now contaminating by your own accord. And then you're going to pull that stretcher out and go to a patient with hands dirty going, hey, how can I help? And they're already immune compromised? I don't think so. That's how come I'm teaching you that as you're approaching, if you don't already have a pair of gloves out, you need to be getting them out and putting them on. That way we're decreasing the amount of germs I'm bringing to the patient. Because again, yeah, we don't live in a germ-free, sterile world out there, but we do the best we can by decreasing the amount of germs I'm bringing to my patient. And that's not to mention all the contamination that you just did to your own equipment. I never understood it. Okay, that was one of the things as a field training officer I had to beat down into these EMTs because they get so excited and they got gloves on. And I'm like in the passenger seat going, okay, you need to take them gloves off. I said, and by the end of this shift or by the end of this call, you need to wipe off your steering wheel and everything that you touched in the console. I don't understand. I'll explain it to them. And that's exactly what I had to do with multiple EMTs who just didn't get it. Anybody got any questions over TAPO? Okay, so here's where the fun begins. Okay, so everybody put up your stuff. I need for these 2 tables to be brought to the front or pushed to the side somewhere because we're going to actually pull out the stretcher and we're going to teach about stretcher functions and patient assessments and stuff like that. I'm going to give you a point of weight, and so hopefully we can have a little bit of fun and learn. tables, don't drag. I've already broken 2 legs that way, so please don't drag my table. Maybe just take that piece all the way to the wall, that way you can have this whole area to play. Oh, you're fine, don't worry, no worries.
It's not the battlefield, so you know.
It's always the battlefield.
Now, I know that stretcher operation is not until later on, in the semester, but since we're trying to stuff like that, you need to become very familiar with the equipment that you'll be using on every single call you go on in the EMS world. There's gonna be those rare situations where they'll meet you at the side of the ambulance or something like that, so please be mindful that this is going to be one of those pieces of equipment. You need to, 1, understand how it works. 2, you need to understand all aspects of your stretcher, because proper operation is going to be important, because if you don't, you're going to hurt somebody. And I'm here to tell you, in the EMS world, if you happen to be that person who gets their partner injured because you failed to communicate, you're going to be ousted in that company for a long time. So please understand how your equipment works, all right? Are you recording?
I am.
He's gonna be recording them and take photos.
Okay, so, come here, Harold. Okay, so this is the stretcher, all right?
Gang all day.
Just a second. Please understand, there's a couple of things. This is the locking mechanism in the back of the ambulance. This is what your stretcher locks into in order to secure your patient to your ambulance. There's a rail up there at the very front where the wheels lock in, and then the actual stretcher locks into this particular mechanism. If this ambulance is ever in a wreck, that stretcher ain't going anywhere because of the way and the type of mount that is used. Normally this stretcher is not going to go anywhere because it's mounted through the floor with major bolts on both sides, so that when this thing locks in, it's meant to stay in place with a collision.
Well, the patient's gonna be all right.
Yeah, the patient,
We're gonna
again,
be-
I know, y'all are gonna be,
We're gonna be inside of a-
ejected
like a
out,
garage.
okay, so, again, understand the medical field that you're going into. I am asking you to put your life on the line every call. There has been a significant increase in ambulance wrecks, and if you don't believe me, I could pull up about 20 that's happened in the past 10 days across the nation. It's crazy, okay? Whenever I was in the field in the 90s and the 2000s, I mean, it was like a rarity. You'd hear like one ever so often. Now it's almost on a weekly basis that you're hearing. And you're talking EMTs and paramedics are either being crippled That's when the EMS world is so different from everything else. It's just like the military. We ask our military to go into harm's way. I'm asking you to do that on a daily basis. Because we're not harnessed back here. We're not even in a seatbelt, especially if we're getting constant care. That's how come, again, research has a lot to do with things, because now the State Office of EMS is now changing the rules to when you will use lights and sirens. Because for whatever reason, people freak out when they see lights and sirens coming. They don't know what to do, and it just draws more attention to us, and we really not necessarily want to take that risk anymore. Okay? So, what I need for you to do, okay, is as I pull this out, I want you to grab the legs. Grab this, you see the black handle? I need for you to grab it and just hold it there until I tell you when to let it down, okay? Now, when you let out this stretcher, okay, keep holding it. There is a bar and a catch bar back there. Now I'm gonna pull the trigger, and then I want you to easily, gently lower them legs. Okay, go. Pull up, and go down. Go all the way down. Okay? There's a catch bar, it's a safety bar, okay? This bar is important because as I'm pulling out my patient, this bar is gonna catch on the hook to where I don't continually to come out and then my stretcher goes down to the ground with my patient. Okay, so again, understand how your equipment works. This is important. Don't ever, never, safety never takes a break. Always ensure that this bar gets hooked on that hook prior to you doing anything else with the stretcher. The stretcher operation is a 2-man operation, not a 1-man. Okay, with this particular. So once we get it out, the legs are dropped, they're locked into place. Did everybody hear that click? Okay, that means that it's locked into place. And then you will remove this from the hook, and then you will let the stretcher out. Now, if you notice from the side, it is at an angle. Does everybody see that? This means that it is in the load position, which means I'm getting ready to load this into the back of the stretcher, or into the back of the ambulance. In order to maneuver this with a patient on it prior to loading them into the back of the ambulance, I need to bring this down to another level, which will kind of even everything out. So, anything red on your stretcher does something. Okay? Anything red does something. So, we'll start up here. This is the catch bar. Okay, so you have something red here that moves the catch bar. This is a handle that if you were to pull it, it lowers the head down in several different locations. That's one. That's the second. There's a reason for that, and I'll explain it here in just a second. Anything red. Up underneath your stretcher head, okay, this is a supine position, flat. If I want to go up at a 45-degree angle. This is semi-Fowlers. Full Fowlers. Anything red does something, okay? I didn't pull on it, didn't yank on it. I just gently pushed it in, and then the hydraulic on this thing is what is so tight, okay? This is a hydraulic. It's what's got pressure. If I want to relieve that pressure, just gently squeeze and let it go, okay? Position of comfort is where we want our patient, okay? Again, anything red does something.
It's already zoomed all the way back.
Okay? On the side rails, you have a red handle. See the red handle right there? You squeeze it, and the armrest comes down in 2 locations. One is flat out. The other one is completely down. When you are helping your patient onto your stretcher and they're able to stand, then you would let this all the way down to the side, and then you'd have them sit down, and then by the time they sit down and you properly restrain them, then the armrest comes all the way back up for transport. You cannot load the stretcher with the armrest in the down position to get them into the back of the ambulance. Ain't gonna work. Armrest will always come up. Okay?
And you put it down to move from here to the ER bed.
Yep, that too. And we're gonna play with that in the upstairs in the hospital room. So that trauma room is mine. Okay? And that's for y'all to be able to take from a patient from your stretcher onto a hospital bed. So that's what's up there in the trauma bed is a hospital bed. And y'all gonna learn how to pull, maneuver your patient.
Yeah, you
Okay?
do it with the blankets.
Anything red, so you have a red knob here that pulls out. Okay? That is for any assistance that you will need from firefighters or other personnel to help you move the stretcher, whether it be to lift because you have a 500-pound patient,
Right.
or if you need more stability when you're going on uneven terrain. This is what the pull bars are for. Okay? Now, here, I'm not going to show you this one just yet, okay, because I want you to see this. Okay, so this red handle, you have to understand, okay, if I was to pull the bottom one, the top one's going to do the same thing. This is an adjustable, or if you will, 2 different positions in which you can grab the trigger on your stretcher to raise it and lower it. Now, this is great for short people, this is great for tall people. Or if you have a situation where you need to get better grip and this is like way too high, then you go below. This handle does the same thing because they're connected. All right? So with that being said, understand how your equipment works. And there's one other thing that you can do on the stretcher that doesn't have a red handle. Trendelenburg, if you'll, okay, just like that, Trendelenburg. And again, that's not red, but it is a function of your stretcher. In order to get them out of Trendelenburg, you would lift a little bit and then you'd actually push that to where it slides back down. So, in order to properly get this in what we call the normal position, is that whenever I pull the trigger and I have my partner at the other end, in order to go down, I have to go up slightly to go down. When I pull the trigger and me and my partner go up a little bit, what that does is that relieves the tension off the legs in order for it to be able to move in another location. Okay? So Errol, I want you to grab the stretcher and I'm going to pull. What I'm going to need for you to do is go up just a little bit and then we're going to take it down a notch. Okay? So I'm going to communicate. Communication is very important between me and my partner. If I don't communicate my intentions, how is he going to know what I'm doing? This is how you do not hurt your partner or your patient. Communication is very important. I gave him a directive. Sir, I need for you to lift up when I say when, and then we're going to go down a notch, and then once you hear it click, then that means you know that it clicked into another location. Okay? Going up, ready, on 3. 1, 2, 3, go up, and then come down. All right? You hear the click?
Mm-hmm.
Now, this is what is the proper level we need to be when we're maneuvering our patient, whether from their location to our ambulance or we're taking them over rough terrain. You notice that it's nice and level now. It is out of load.
You just press the trigger. You just press the trigger.
I just pulled the trigger, and again, in order to go down, I just can't pull the I can't pull the trigger and push it down. I have to go up a little bit to release the tension off the legs, and then go down a notch. Now
Part of
this,
the safety, you have to do it on both ends.
yes,
The handle's just on
the handle's just on the
When
one.
do you
So,
want to let the trigger go? Is the
after the click, yes.
okay, so here we go. Good question. How do I know when to let go? Okay, so if Arrow was to get back over there and we were to go down again, because this thing goes down in about 5 or 6 different positions, is that once I come up and I begin to come down to another level, I'll let go and then wait till it clicks into place. Does that make sense? Okay, so again, on 3, up 1, and then ready, 1, 2, pull the trigger, up on 3, and then I let, so as we're letting it down, I'm letting go of the trigger. Did you hear it click?
Mm-hmm.
So as we're lifting and coming back down, let go of the trigger, and then it'll lock into another position. So this is like halfway, come on, one more time. And then now we're gonna go all the way down. Okay, so I want you to see all the different levels, because I mean, there is levels in between, but these are the ones that we use most. On 3, 1, 2, 3, up, to go down. Oh, sorry, one more time. Okay. This is all the way down to the ground, is what we call it.
And that's how it be loaded. Oh, it be up some?
It's gonna be all the way up and low where it was tilted. So if I have someone that we're having to put and put them on the stretcher, I'm not gonna try to put that load of patient all the way up. Put the stretcher down to their level, put them on, and then we're gonna raise it up together. Now, this is where I'm telling you that this job is physically demanding. Because guess what? Not everybody's height and weight proportionate. And we're gonna be dealing with about 300 to 350 pound patients on a daily basis. Total weight.
Don't skip leg day.
So here we go.
Mm-hmm.
The stretcher alone weighs about 50 pounds by itself. You put a 250 pound patient on that, you've got a total of 300 pounds you're having to move. Okay? Now, proper way to grip this stretcher is always from up underneath and grab the bar. It will never be like this. You will never grab the bar from the top side. Never, ever. When you do that, you don't have enough strength in your fingers to hold a 300-pound patient and be able to lift them properly. It will always be an undergrasp, if you will. Okay? Now, not trying to be discriminatory, but ladies, you need to know your limits. If you can't lift a patient, don't even try. You better be calling for help. And that includes being here. Because again, know your limits. If you don't, you're going to wind up hurting yourself as well as your partner. And if you ever sustain a back injury in this field, you are done in this field because of how physically demanding it is. I'm telling you, Murphy's Law, the elevator will be out and you'll have to go up 4 flights of stairs, sometimes with a stretcher, sometimes with a backboard, and sometimes with that beautiful chair right there. Okay? Okay? All right? But in order for you to appreciate that chair, we're going old school where you actually have to pick up everybody in that chair. Because believe it or not, some of the services down here don't have that nice accommodating chair. They have that one right there. Okay? Now, Errol, get back over there. So on 3, we're going to take it all the way up. So put it all the way up. Okay, ready? 1, 2, 3. Okay, wait till the legs, and then you hear the click. Now, this is in load position. This means I'm getting ready to load this into the back of the ambulance. You see the tilt, okay? This is load position. Now, I saved this lever right here for the very last, which is on the undercarriage right here. Vanna.
Can I get a lever, please?
Okay. Now the operation of this, okay, this is the only time a single person will use this lever. It is to take and drop this stretcher to any different locations that I need to without a body on top, okay? Because again, it's all going to be mechanical, if you will. So if you pull the lever,
Releasing his weight on that bed, it's going to go.
it's going to go soon. It's going to break your hand in several different places, okay? So if I pull the lever and I put my foot down, remember I have to go up to go down, and then this will take me down again. So this is for a one-man operation with nobody here in order to put this at the proper height that you require. Okay? I can also take that all the way back up without someone on it if I need to. Okay? That's the only purpose for that lever. It will never be when you have a patient on top. Okay? So, proper body mechanics on how to properly lift is going to be important, not just for your stretcher, but if I was to take this backboard and actually put somebody on it, I have to do proper body mechanics. You have to lift with your legs. You have to lift with your legs. If you don't, you are going to rip and tear all of these muscles right here, and you will no longer have a job in EMS. It only takes one injury to your back to eliminate you from this field. Yeah. Yes, it is. Okay? Okay? So it's important to properly lift. This is how come, ladies, it's important to know your limits. If you don't think you can lift it, don't try it. You better be calling for help. Because one, no one in this class is going to get hurt because you failed to call for help, and then by that time I've already intervened. Okay? Okay? Believe it or not, I had one of my advanced classes pull one of my students that was on there, and they didn't properly hook it, and she came right out of the ambulance, and that stretcher went from this step to this step, and I'm sure y'all can imagine the wham effect, and she jumped off of that stepper so quick she had unbuckled everything, got off that stretcher before it hit the bottom. So, okay? So that's how come it's important. Safety never takes a break. Ensure that when you are pulling the stretcher out, this bar gets hooked. Now, sorry to tell you, short people, I'm one of those, okay? With this particular height of the back of the ambulance, it's actually about 6 inches higher than it needs to be, okay? I did not design this, so this ain't. So which means for taller people, this is going to be great, because by the time you lift that tail end and you're about right here, it's going to be level with the floor in order for you to make that nice glide in to click in, okay? So again, properly lifting, you're going to have to lift with your legs. So if I'm lifting this with someone on it, right, okay, lifting with my legs, okay? It's not gonna be like, okay, I'm ready. Okay, this is not the way we need to do it, okay? Because that's a good way to tear your back muscles, all right? So, here, I'll tell you, when it comes to the stretcher. Raise that one, go back all the way up on 3. 1, 2, 3. Okay, all right. Now, when you are loading this stretcher into the back of an ambulance, okay, you're always going to have someone at the side, and he is going to be maneuvering us into the location where I need to go. All right. Now, if you've noticed, okay, his proper instinct was to line up the wheels with the front of that guardrail up there, if you will. Okay, this is not where I need to be. Again, instinct. You're like, well, it's got to go straight in. Okay. Instinct is to take it straight on. Okay. What I'm asking you to do is go off kilter just a little bit to your side, and then once we get the top of the stretcher where it needs to be, it's his job to ensure that this hook gets hooked. Okay, so I'm going to be pulling back, and that needs to be hooked. Okay, as you notice, it kind of likes to go at the very top. So you're going to have to ensure that it gets hooked before I click and lift, because his job at this point is to ensure the bar stays on the hook, as well as lift my legs up in order for us to glide the stretcher in.
And then you're going to be keeping pressure this way to keep it on that.
I've got to engage the handle during the whole duration until we can get them in, and then I'll let go of the handle at that point. Okay. So again, understand your equipment. In order for him to go up, he's going to have to go down, which means I'm going to be lifting up to bring the pressure off the wheels. He's going to have to push down a little bit and then come up with it before we can go in. Now, he's pretty strong, okay? So his intent is to actually grab that sucker and kind of be forceful with it. But if you do that, because no one's on this, is you're going to tilt the stretcher. So you have to be careful on this side, because we want to lift it together, okay? Not go like this and try to lift it up in there because he's strong on this side, okay? You have to have that nice equal balance. So let's see if we can get this in. Ready? Okay, so hook, ready? And then I'm going to lift up, push down, bring the legs up. Okay, you see that? Okay, now, let go. Okay. Now, you notice how quiet that was?
Mm-hmm.
You notice how quiet that was? And then the only click that you hear is that one?
Mm-hmm.
That's what I expect out of each of you. Because this is the tendency. When you don't line up the way I showed you, this is what you'll hear. Okay? That's what you'll hear.
At least it clicked. Did anyone die?
Okay, so again, keep in mind that there should be a nice flow in. The wheels go up to the top, and then you slide over, click, you're in. Think about your critical patient that you've just now caused, more headache and stress with because you're trying to get them in and lock them in and can't. Okay, that's how come you all kilter just a little bit from center, and then once you push it in, now here's the thing. How many of you remember physics in high school?
A little bit.
A little bit? Okay, here we go. So if I get a patient in there and I'm not quite right, and I have two wheels in there, two sets of wheels, meaning the front and the ones in the middle, I can now use this as a fulcrum and move the head in any direction I need to go in before I actually get them in and line them up so that it's a nice transition in. Use it to your advantage. Fulcrum, you can manipulate. I don't care how much pressure's on there. Because again, when it's out this far, your weight is going to counter the front in order to use the middle to decide on which way you need to go in order to properly line up your wheels up there to the front carriage, lock it in, and then you hear the click.
You're a pro.
Okay? You don't want a lot of jostling and knocking and stuff like that. That's not cool for the patient. If you've ever experienced it, you'll know, which all of you will here in just a few minutes. because each of you will be on that stretcher when someone pulls you out and lets you down, and all the different levels on that stretcher, because this is how we're going to get very familiar with our stretcher.
Mm.
So each of you will pair up and you'll kind of rotate. And again, the first person will grab here. They will unlock it from the mechanism. The only thing you do with this is you push it in until you hear it unclick. Ready? Okay, unclick. And then you slide it out, and then it'll be a nice transition out. So this person's responsibility is to pull the lever. Okay? Now, there's two ways that you can do that. One is that you can pull it as you're pulling it out, but it's very important to ensure that the person on the side grabs the carriage, because this is another little pet peeve of mine, is that I do not ever want to hear them wheels slam to the ground, because the person on the side failed to grab the carriage. It is a nice type thing, okay? I say all this to say this. This is how we keep the longevity of our stretchers if we take care of it. Because let's face it, when you're out there in the field and you're having to go over rocks and rough terrain, this is when this sucker gets beat to death. I don't need to add to it by allowing the legs to slam down, because then the wheels and all this other mechanism down here can actually break apart, okay? So we're trying to salvage, okay? These things are like 12,000, something like that.
To make that part of the inspection after every day, you're checking your stretcher, checking.
Yeah, checking everything, make sure things work, okay? Because
Nothing's
you'd be
broken.
surprised at how many wheels fall off and things like that when people don't check their stuff, okay? So again, person number one here, you have one or two options. You can either pull the lever once you get it all the way out, and then the person on the side grabs the carriage, and then as he pulls up to go down, then he releases the handle until it goes all the way down and you hear the click. Or you can pull this all the way out, and you communicate to your partner, okay, I'm going to pull the lever, then they will know to lift up on the carriage and go all the way down, and then you release once the legs hit the ground or once the wheels are on the ground. Does this make sense?
Yeah.
Okay, so let's try it.
Okay.
And Joseph?
Okay.
Okay. So again, communication is important with your partner.
Okay.
So, ladies, if you have the fake fingernails and the long fingernails, guys, I mean, those need to be cut off to at least fingertip, where it barely hits the end of your fingertip. If not, you will break fingernails. You will get your fingers caught in this thing if you're not careful. So a nice, easy process to bring it in or to take it out and get familiar with your equipment.
Go on the side. I'm going to release, lock, and release. There we go.
Okay? So at this point, you need to communicate to your partner, are you pulling the lever or are you not? Okay? So she knows that that carriage is going to stay where it's at as it's being pulled out. She's still going to monitor it as you're slowly walking backwards. So slowly walk backward. Okay? Hold on to the stretcher. So this again, so hold on. So this is the bar part where you want to kind of hang on to. And then your job is to pay attention to that hook bar. Okay? So as he's pulling it out, okay, you're going to feel the drop with the legs, and then you need to ensure to him that that lock bar is hooked.
Where
And
we
she
at?
will tell you when
It's locked.
it's locked.
Okay, I'm going to be pulling the handle.
Okay, so at this point, what did I tell you about grabbing the handle? It will always be like this, okay? So when he pulls the handle,
Pulling the
you're going to
handle.
lift up just a little bit, and then you're going to bring the legs down.
All right, I'm about to pull the handle. 3, 2, 1. Pull.
So pull up,
Oh,
and then you just take the legs nice and easy all the way down.
Mhm.
Bend, girl. And then he'll let go of the handle. Okay,
Lock.
until it clicks.
Oh. Ah.
Hear the click? Okay. Now you have properly unloaded, and
I don't
so
want to actually let go at that point, probably.
you know,
Yeah.
always safety.
Okay.
Okay. So at this point, she's going to use this in order to relieve the hook, and then y'all will pull the stretcher out, just like that. Okay. Now, you two are to take it in all the different positions and whatever else that thing does. So everything red, you need to put your hands on it. That means lowering the stretcher, moving head positions, moving arm bars, everything.
Wrong way, wrong way.
Okay, that's halfway, and then you do it again, it'll swing all the way down. Now, the importance of this right here is once you take it out of load and you're flat, if you need to take this into a full Fowler's to get around tight corners, you have just cut off the extension of your stretcher in order to get around a sharp curve or whatever. That's the purpose of that. So, when we take the stretcher out into the hallways and stuff like that, please do not bang up my door or the door jams, as you can see. One of my EMT students did last time because they weren't paying attention. So please do not bang up my door or the walls, because you should be able to know how to navigate this stretcher in tight spaces.
Go ahead and bring that back in.
Damn chair's not
Under grasp, honey. Under grasp. Okay, now, here's the great thing about this too, is that it actually can go one notch in the wrong direction too, if you needed it. Okay, so, once this is down and once the head of the stretcher is down, you need to take it out of load. So you need to go down a notch with your stretcher.
Right. That's gonna be it.
Yeah, let her put the head of the stretcher. Remember, it's got a,
I think you have to up and then down, no? When you set this in, is it
She
forward
said the
and back
hydraulics
again?
were tight,
the
so.
hydraulic is tight.
Okay.
So in order to do that, you're gonna have to get and settle yourself, push it in just slightly, and then bring it down
Okay, so
because
it's
of the
not forward and
hydraulic.
then back.
Right, because it's tight. It's gotta be in order to maintain the position that you're locking it into. So communicate with your partner.
And then release and lift up. And down. Lift up.
Lift up, there you go.
Alright. Got one. Alright, we're gonna do it again, lower it down one more time, and then pull. Lift up. And down.
I think, Joe, you need
Lowest
to,
position, we missed one.
my bad, Joseph.
There's several in between.
I think you should count. 'Cause
Do a count, yeah.
Yeah, count like
Yeah.
1, 2, 3. That'd be
Alright,
better.
so we go back up to that mid position.
Cause you just like lift up and she's not really good.
Hold it, hold it, hold it. 1, 2, 3.
That's in mode. Just swap positions. Going all the way down and reaching down here is not gonna be in your best interest. You need to kind of bring it here to go down to the halfway level, and then again, on the way down.
Yes.
Because this is at a higher level, which is more comfortable for you,
Yeah.
right? So is this more comfortable versus now grabbing down? Now, is that comfortable? No. Okay, so again, use this to your advantage when you need to, okay? Squeeze, go up, go up.
There you go.
And then come down. Okay. You're gonna have to let it come down a little bit before you let go of the handle,
Oh.
because you're still staying, yep,
There
yep.
you go.
Go up, come down a little bit,
Hold that,
let
hold
it
that
come
cable.
down before you let go of your handle.
Cause we're just gonna go back.
Got like
and
20
forth.
positions.
Alright, so on you go. You got this. You got it.
We're looking good.
Hold, let go.
Because one time.
Okay, there you go.
1, 2, 3.
Come up a little bit, hold, let go. Okay, and then one more time all the way down to the ground. Yep. Okay. Let go of the handle. Okay. Talk to your patient, talk to your partner as far as where are you going? Are you going all the way up, going halfway up, going 2 notches?
3.
Okay, so Aaliyah, you have to understand, honey, you have to lift. It cannot be him alone, okay? So whenever you're going, especially all the way to the top, and you need to lift your end, because what's happening is that you're just kind of doing this number, and he's actually doing it for you, okay? So you gotta lift with him and let go before you put down, okay? So don't be afraid to lift, you know? It's just you don't wanna overpower Joseph, which I know you can, so, you know, just
Okay.
don't flex your muscles too much, man. Don't do it, okay?
Put that on your card. EMTV video.
Okay?
As far as these are the
It's again, the hydraulic is so tight, you have to, you know, put some muscle into it in order to bring it down to whatever location you want to. Going up is easy, coming down is the hard part.
And then this was from that to 1, go in, down, and then you could push this up. Foul is not gets through the hole.
Yeah, and just ensure that you're out of load, because you're currently in load right now. Yeah. Mhm.
And I probably want to bring this back up before, so I have something to put my waist against to pull this.
Yeah,
That's it.
yeah. Because it does take some elbow grease.
It helps a lot, all this energy I need to, if I have something to get from it.
Mm-hmm. Okay, so Joseph, since you pulled it out, Aaliyah's gonna put it back in. So again, it's important that when she lines up, that bar is very important, so you always come here as she's bringing it to load to ensure that this bar goes over the hook and hooks before she lifts and actually installs.
Okay. So you want to air to the right side, you ready?
Just a little bit, just a little bit to the right, it doesn't take a whole lot. That means you're gonna have to lift up on your end.
We're gonna have to go up, or you want me to lift like that and get it
Okay,
over?
so 2 things can happen. 2 things can happen. Either you can lift it up in order to get it up on the back of the ambulance, or she can actually push down and kind of roll to you.
Okay, so and she's
So
using
use
that
your weight as a
fulcrum.
fulcrum in order to kind of
Okay.
get it, because again, the back end of this is a little bit higher than a normal ambulance.
And we've got the catch.
Okay,
You gotta do the legs though.
okay. So Aaliyah, this is when the bottom one's gonna be important for you to grab, so that means you're gonna have to bend at the knees, grab. Okay, so here's the thing. The closer you are to the weight is going to be in your benefit. So the further away, you're using only these muscles, whereas if you're closer to it, you can lift the way you need to. Now, this is gonna have to go up to about right here in order to get it level to go into the back of that ambulance. Okay, so that's how come the lower bar is now gonna be your friend. When you pull the lever and you lift completely, you're gonna have to lift completely up to about right here to where the weight comes off the legs and he's able to push down a little bit to bring the leg carriage up in order to guide you in. Okay? So the closer you are to, yeah, there you go, okay?
Talk to me.
1, 2, 3.
Lift out, lift Aaliyah, lift, hun, there you go. Okay? Alright? Okay,
You're
y'all
gonna
are
guide
so
it in.
way off.
Mhm.
Okay, the front of those legs need to be in that carriage up there. So you're way off. See how many dings? Ding,
Mhm.
ding, ding, ding.
Are we
Would
gonna
I be up
practicing
there
with
to
each other?
help her at this point? You wouldn't go in?
Okay.
Well, here's the
So
thing.
at this point, this
You've
is
got
her
to-
control.
You've got to learn how to put
Guide
it in
it?
from this direction.
So it's gonna guide it from my side as well as.
Yeah, you
okay,
can help her guide the front end, but again, it's her responsibility. She's at the tail end to be able to line it up and then click it in.
Right, so
So
that's
put
on
it
me on the
in.
initial guide.
Let it click,
I got roast beef at the house.
okay?
Nice.
There we go.
So again, you heard how many dings you had to go through? So it being your first time, okay? Ding, ding, boom, ding, ding, okay? We're going to decrease that over time. I'm not expecting y'all to get it on the first try, okay? But again, I want you to pay attention to what you're doing as far as that's concerned so that you'll know how to, okay, well, we need to adjust the front end a little bit. Okay, this is where you as a guide can say, okay, we need to take the head of the stretcher and turn it just a little bit.
She would go out
So,
to the right a bit.
and
just
then
help
she'd go
guide
out a
that
little
in.
bit, and then once she locked it in, then it's just a matter of a clean click. Okay? All right, 2 more people.
Alright.
Come to me.
Yeah. You can set it up on that box over there if you just crack it like that. Crack it like the smallest amount.
Oh, okay, cool.
Yeah, and you just put it on that box. Okay, yeah, that works for me.
Communicate. Is anybody here partners?
Yeah.
Y'all 2 are partners? Okay, so y'all 2 will need to do that since y'all are partners. I didn't realize that. we were
Got it right here.
partners.
I got the thing. I'm not holding the out right now. I'm not holding the red. You know, we'll cut that out a little bit once we get this.
All right, man,
Anyone
grab the
so-
side. Grab the side. There you go.
Keep going.
Alright.
Keep going. She'll tell you when it's hooked.
It's up.
Alright, cool. Can you grab it? 3, 2, 1.
Come on.
Yes.
You stay up high while she lets the legs go.
Gotcha.
While she brings down the legs, and then you'll hear the click, and then you can start bringing down, coming down. You hear the click?
Yes, ma'am.
Okay.
Yes.
You're gonna feel a slight bump as it coming off. There you go. Now you're in the load position, so you need to take it out of load.
Grab the thing and then close it.
You're in load like this, honey, so you need to bring it down a level in order to come out of load.
Alright, I got the thing. I'm gonna drop it down. 3, 2, 1.
Let go of the handle. That's way too low.
Alright, alright.
Come up, come up 1.
3, 2, 1, up.
Let go of the handle. You hear the click?
I heard the click after I let go. Try this again. Alright, 3, 2, 1. I got it. Come up.
Let go. Okay. Now you're in the travel mode, if you will. Okay. That's about how high you need to be.
So we're in sport mode, right?
Yeah. So again, I know. So again, this one's got several different layers. You got like 5 or 6 positions. And so when you're in load, you just want to bring it down a notch to where now the head is not at an angle, it's now at level. Okay, because the only thing that you want to be moved is just the head, not him, until you get ready to load him into the ambulance. Okay.
Bring it down another level. Alright, I got the lever. Moving 3, 2, 1. Up. Yeah.
That's another level.
And again. 3, 2, 1. There we go. And
Okay,
last
so-
one all the way down.
Oh. Okay, so hold on. When you're pulling the lever, okay, you want to go, okay, on 3. 1, 2, 3, pull up and down. Okay, because if you pull that and this thing happens to have a glitch in it or something, you and your partner going straight down. Okay, so, okay, on 3, 1, 2, pull up and then come down and then you let go so it'll click into the next position. So just be careful with that. It does have safety options in the fact that every time you hear a click, it should click into a location, but you never know something to malfunction and you don't want everybody to go slamming to the ground.
Yeah.
Because that's going to break your hand and probably break hers, or at least the wrist anyway.
Going down. 1, 2, 3. Up.
Okay, all the way down. Yeah. Okay, so swap locations.
Oh, we never did this thing over here.
That's okay. You can do it when you get up. When you bring it back up.
1, 2, 3.
Communicate. Where are we going? We're going halfway, up a notch, all the way, into load.
Yeah.
Okay, communicate.
Okay. 1, 2, 3. You ready?
Yes, ma'am.
1, 2, 3. One more. 1, 2, 3.
All the way up, right? Or
Yeah.
just, okay.
Next leg.
There you go.
Okay,
It's
so
sticky. This one's
communication is going to be important. How did you know you wanted to go all the way? She never said. You're like, hey, we're going all the way, what are we doing? Okay, that's not the time to be making that decision when you've got a lot of weight on your hands. Okay, so again, communicate, hey, we want to take her up to load, so here we go, all the way up. On 3, okay? Communicate with your partner, because again, this is great when no one's on it. When I put somebody on it, then you're gonna be going, oh my God, we should have said something earlier.
So it's load, then travel.
And then
And-
the different sizes, and then
And
all
then
the way
there's
down.
3 more after
3 or 4.
that. Okay.
Oh, so we skipped a couple then
So,
when we were going.
You don't need.
And that's fine, because I mean, again, it's all
Yeah.
gonna be
Yeah.
dependent on the
Yeah.
patient and where you're gonna
You
be
don't need
pulling
it.
them from.
I
don't need
I'm gonna
that.
start making more
So go ahead and play, yep.
It's good to know we got options though.
Here we go. Pulling, getting it the halfway point. Alright, I'm going all the way down.
It just hangs.
Alright, now I'm gonna bring it back to the halfway point. And now I'm gonna go all the way back up. Go. Alright, going semi. Going all the way to Fowler's. And I'm bringing it all the way back down.
It'll be in position of comfort for your patient.
Alright, cool. Now go right back up.
Come on, come on. The safety bar needs to be pulled up to where as it's going over that hook, it'll hook properly once she gets it in. So go ahead and flick, there you go, and then have her.
Alright, 3, wait, lift.
She's
No,
gonna
no,
go
she's
down
not
on
gonna be
her
moving,
end.
she's gonna be pushing down a little bit in order to go forward to get the wheels on the back side of that ambulance.
Alright, well, you're clear there. Perfect.
There you
Yeah.
go. Mhm.
And good moving.
1, 2, 3.
Lift, lift,
put it
lift,
down on
lift, 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 lift.
Nope, nope.
No, you're overpowering, okay. Alright. Look up, look up, look up. Okay, here's the thing, when she pulls the lever and she's lifting, you have to push down slightly to take the
Okay.
tension off the legs and then lift up straight,
Okay.
okay? Don't try to,
Go
Okay,
flip
'cause
that
this is-
patient.
All those muscles, man.
just straight up, straight up, okay? Straight up, legs need to come straight up, not at an angle, okay, cause that's okay, so when you lift, you need to lift high enough to where the pressure off the wheels or off the legs. So again, push down a little bit in order to come up, okay, ready, and
There you go.
all the way, no, let's keep pushing until he's set, and
Alright.
then now, there we go.
Go. Figure out. Looks like you got
Nice.
So about 7 clicks, you hear it, keep.
You
So
were
again,
careful.
first time, so, yeah, you were careful, but again, okay, so, again, first time, so this is what you're gonna be doing like for the next hour. In and out, stretcher, in and out, getting comfortable with it, because this is gonna be your best friend on every single call. And guess what? When you are lifting and moving this particular device, okay, one time to pull it out with your equipment to go to the patient. So, okay, one time, in and out, out of the ambulance. One time at the side of your patient, to either go up and down to put your patient on it, so another 2 or 3 times. Then you're gonna bring it back here in order to load it and put him in, and that's about 4 or 5. And then by the time you get to the ambulance ramp on a hospital, now you're having to pull him out, and then get to a stretcher, and then slide him over on there, and then you're gonna have to come out here, clean it, and then put it back in.
And then
That's
pass
about
out.
6 or 7 times, 8 times that you're dealing with your stretcher on one patient. This is how come I'm starting out early instead of having, I mean, unless you really want me to lecture for you for the next hour.
We're good. We
Okay,
No, this is
so
good.
again, this is gonna be important when we start talking about patient assessments, because when you go to a particular location, your stretcher's going with you, and so is your equipment, which happens to be your jump bag at the time or whatever else. Jump bag, oxygen tank, suction unit, whatever you think you need, all that equipment needs to go in with you at one time. Okay?
So you just
So
throw it on the stretcher.
throw it
and
on
you
the
just-
stretcher, but guess what? Now you're gonna have to carry all that crap as you've got a patient on that in order to get him back to your ambulance and stuff. And again, sometimes you're gonna have to go over rough terrain and things of this sort, and y'all gonna know what that feels like because next week, maybe even Thursday we're in BLS. So next week we're gonna be taking that stretcher out with your equipment and we're going outside. You're going to know what it feels like to go over that rough terrain and then through the rocks in between the parking lot, you know, the rocks that's in the island. Yeah, you're going to be going through that, and then I'm going to take you over here about on the backside and have you just drag your stretcher through the grass. So be prepared. I told you, closed-toed shoes and stuff. Get dirty shoes and get dirty clothes because this is what we're going to be
I got my
doing.
storm pants at the house.
Okay, because again, our world is not controlled where we have nice, flat surfaces to ride on. Okay, so in order to get you exposed in the different mechanics of that stretcher on different terrain, you've got to be out there in it to know what it feels like. So that's what we're going to be doing next week. So become familiar. So for the next hour, that's all you're to do is to play with that stretcher because at 12, I'm going to take a couple of you and we're going to do stretcher operation with a person on top. So become familiar with this piece of equipment because before you leave here today, someone will be on top and you'll be lifting and playing and stuff like that.
My question is, can we come in here and actually practice when we get ready, or is there we're not allowed to because of this whole?
Say it again.
I said, are we allowed to come in and like practice and stuff in here, or we're not gonna be able to do that because of like the COVID or whatever?
You can come in and practice on Mondays and Wednesdays from about 8 o'clock in the morning till about noon because I start the advanced class at 12:30 and go until 4:30.
Can we can't come in after 4:30?
You can just let me know.
All right. Yeah.
So that I can make arrangements to be here. Because
Yeah.
normally, because I start my day at like 7 o'clock in the morning, and so by 5, I'm normally out of here. So if you want to just come stay and play, that's fine. Just let me know so that I can make arrangements to be here.
Yeah, I get off work at like 6, so that's my problem.
Gotcha.
Yeah.
Well, I mean, you know, we can make it work if we need to. I can stay late. I can find